What are the 3 leading causes of death in the United States today?
Diabetes, cancer, and heart attacks.
Smoking is one.
Auto accidents.
Alcoholism.
Suicide.
Car accidents.
Drugs.
Cancer.
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 Heart disease.
Heart disease.
Heart.
AIDS.
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 Hello and welcome to this fabulous new show. I'm your host, Dr. Smash. I'm not a real doctor. I just play one on television. I'm kidding. I am a real doctor. Stick around. We're back. We're in the middle of a very important procedure right now. We'll be with you in a minute. Oh, Charlie Horse nails it. 400 points. Okay, go ahead. He's going for the funny bone. Who was that? As you can see, the topic of today's show is the cardiovascular system. Cardio comes from Greek for heart. Vascular is Latin for blood vessels, specifically arteries, capillaries, and veins. Now, in this episode, we're going to learn all about these components of the cardiovascular system. And once we've got these down, then we're going to dive headfirst into some really important stuff, such as atherosclerosis, myocardial infarctions, stroke, blood pressure numbers, cholesterol, saturated and unsaturated fat, all in this episode. Don't miss it. Tape it if you have to. Let's begin with the top 3 causes of death in the United States today. Number 1 is heart disease. Number 2 is cancer, all cancers combined. And number 3 is stroke. What is a heart attack?
It's a malfunction of the heart in one way or another.
Got a blood clot in your heart,
I don't know what a heart attack is.
And your heart stops beating.
the heart collapsing.
There are a lot of kinds of heart attack.
What is a stroke?
I don't know the difference between a heart attack and a stroke.
Blood clots to the brain or the lungs.
A stroke is when there's a blockage to the blood flow to the heart.
Well, a stroke is when blood's cut off from the brain.
I don't know.
Now, both heart disease and stroke are diseases of the cardiovascular system. And when you combine these two with the other forms of cardiovascular disease, then you come up with an astounding 40% of all deaths in this country are coming from cardiovascular disease. And what hurts so bad is that so many of these deaths are preventable. And that's what we're going to address in this show, is how to prevent these terrible cardiovascular diseases. Now, on this show, we're not just going to stop at the top three. No, we're here to learn. We're here to keep going, so let's do it. Number 4 is infection. All infections combined. Now, HIV accounts for a little under a third of these infections. Number 5 is lung disease. Number 6 is accidents. All accidents combined. About half of these are motor vehicle accidents. Number 7 is diabetes. Number 8, suicide. Number 9, homicide. And number 10, liver disease. These are the top 10 killers in the United States today. Now it's time for a pop quiz. Which of the following is the leading killer in the United States today? Is it heart disease or athlete's foot? What's your answer? If you guessed heart disease, congratulations, you're right. Let's begin learning about the cardiovascular system so that we can learn how to prevent those terrible cardiovascular diseases. We begin with that magnificent building block of life, the cell. Your body is made of cells, zillions of cells. You can't see individual cells with the naked eye, but the tissue that you're looking at is composed of cells. Now, your cells are alive, and in order to stay alive, they need a lot of stuff all of the time. Your cells need
oxygen, water, sugars, proteins, fats, vitamin cofactors, trace elements, electrolytes. You get the idea. A lot of stuff. Where are the cells going to get all of this stuff?
the blood. That's right. Blood carries all of this stuff. This is what blood does for a living. It collects and distributes this stuff to the cells of the body. When the blood flows past the cells, cells are able to extract from the blood the things that they need. So, when you take in a breath of air, That oxygen doesn't just stay in the lungs. No, it's absorbed by the blood in the lungs, which is circulated to all the cells of the body. This is how your cells get oxygen. When you eat a sandwich, the blood in the gastrointestinal system absorbs those nutrients and again distributes them to the cells of the body. This is how your cells get nutrients. So, in essence, the cardiovascular system keeps your cells alive by circulating the blood. Serious problems arise when cells don't get their blood supply. Now, when tissue is cut off from its blood supply, we call this ischemia. And when tissue dies because it's cut off from its blood supply, we call this infarction. Say them with me. Ischemia. Infarction. Now, there are many types of heart disease. There's congenital, autoimmune, infectious, traumatic, but the majority of heart disease is ischemic heart disease, which means that the heart muscle is not getting its blood supply. There are a couple of different types of stroke, but the great majority of strokes are ischemic strokes, which means that the brain is not getting its blood supply. Now, blood in Greek is ema. Words with the prefix heme or the suffix emia refer to the blood. For example, the study of blood is called hematology. If a vessel ruptures and bleeds, we call that hemorrhage. If a patient is deficient in blood, we call that anemia, literally meaning without blood. A malignant overgrowth of leukocytes is called leukemia, and ischemia literally means to hold back blood. I don't know if y'all can see over here, but we have got the scourge of the industrial world right across the street. We're looking at a couple of gruel blobs. I don't think that there's many of them. I don't think that they pose a threat. Oh, can you see them? Let's now turn our focus to that cardiovascular organ of organs, the heart. The heart is a hollow muscle that serves as a pump to circulate the blood. It's divided into two halves by a septum. The right half pumps blood to the lungs. The left half pumps blood to the rest of the body. Each half has two chambers, a small atrium and a large ventricle. Now, like all other muscles, the heart works by contracting. And when the heart contracts, the blood is ejected out of the chambers with tremendous force. We call the contraction phase of the heart systole. The relaxation phase of the heart diastole. Systole, diastole, systole, diastole. This is how the heart pumps. Now, at the exits of each of the chambers, we have a one-way valve that only allows the blood to flow in one direction. Hey, this is an echocardiogram, which is a sonogram of the heart. Now, the heart has four one-way valves, the tricuspid, mitral, pulmonic, and aortic valves, which channel the blood in the proper direction. When these valves close, it produces the sound we know as a heartbeat. So the heart pumps the blood to all of the tissues of the body. Now, how does the blood get from this heart to all of the tissues? Through the arteries. That's right, arteries are the vessels that carry the blood from the heart to the tissues. Like a tree, the arteries branch out to all the tissues of the body. Now, the trunk of this arterial tree comes out of the left ventricle, and it is called the aorta. Now, the aorta loops up, shoots off the carotid and vertebral arteries to the neck and the head, shoots off the brachial arteries to the arms. The aorta whips back down, supplying the abdominal organs with blood, and then it bifurcates into the iliac and femoral vessels, which supply the legs. Arteries are designed for high-pressure flow. As you can imagine, that stuff is coming out fast and furious from the heart. Systole, diastole, systole, diastole. When you feel the pulse, that is the artery responding to that incredible pressure. When we talk about blood pressure, we're talking about arterial blood pressure. Also, the transit time of the blood from the heart to the tissues is very short. That blood really goes moving. When an artery is severed in an accident, the blood will oftentimes go shooting across the room. New from Rough Guy, Tough Guy Toys.
Rough guy, tough guy.
Sergeant Artery!
Rough guy, tough guy.
With his patented handheld pumper, Sergeant Artery bleeds like there's no tomorrow. Just fill up the pumper with your favorite beverage and bleed away.
Rough guy, tough guy.
Also coming soon to Rough Guy, Tough Guy Toys, Corporal Flamethrower and Captain Time Bomb. Each piece sold separately.
Rough guy, rough guy, rough!
take a look at an artery. An artery basically has 3 layers of tissue. The outer layer is the tunica adventitia. The middle layer is the tunica media. Media means middle. This is smooth muscle that equips that artery to deal with that high pressure. The innermost layer is the intima, tunica intima. And inside here we have the endothelial cells. The tunica intima is very important when we talk about cardiovascular disease. Now let's take a look at some arteries in action. This is an arteriogram where we inject dye into the artery to observe the flow of the blood. Oh, a kidney! This must be a renal artery. Renal is Latin for kidney. Can you see how the artery supplies the kidney with blood? Now, if we inject the aorta with dye just proximal to the renal arteries, oh, we see both kidneys, and we see the bifurcation of the aorta here at the bottom of the screen. How many of you can honestly say that when you saw Nimrod's model heart before, you noticed these very important arteries on the outside of the heart? Yeah, right. These are the coronary arteries that you hear so much about. Left main, right main, anterior, interventricular, the list goes on. Coronary arteries. Now, corona is Latin for crown. The arteries are named this way because they form a crown around the heart. Now, the coronary arteries supply the heart muscle with blood. Now, just because the heart deals in blood all day long, systole, diastole, does not mean that the heart muscle gets any special privileges. No, it has to get its blood from arteries, just like any other tissue of the body. Let's take a look at coronary arteries in action. So there you have it, the arteries. Remember, arteries are responsible for carrying the blood from the heart to the tissues. Now, what happens when the tissues don't get that blood? What? That's right, ischemia and infarction. And who's usually responsible when the blood doesn't get there? Something to think about.
Rough guy, tough guy, rough guy, tough guy.
Now, the arteries branch off and they get smaller and smaller and smaller and smaller, and eventually they're inside the tissue. And at this point, they're only 1 cell layer thick, and we call them capillaries. Now, these itty-bitty capillaries have itty-bitty walls so thin that stuff passes right through them. Remember that cells extract what they need from the blood. Well, this happens through these incredibly thin capillary walls. So the blood has passed through the capillaries and has exchanged all of this good stuff with the cells. It's now time for the blood to return to the heart. Through what vessel does the blood travel from the tissues back to the heart? Through the veins. That's right. Veins bring the blood from the tissue back to the heart. Now, veins tend to run alongside arteries. So you have the jugular veins draining the blood from the head and the neck. You have the brachial veins draining the blood from the arms. You have the femoral veins draining the blood from the legs. All of it going into that great cave-like vein, the vena cava. Here's a model of a vein. Again, we have the tunica adventitia, the tunica media, and the tunica intima. Now, when we compare this to the model of the artery, we notice a few very interesting differences. To begin with, the lumen of the vein is larger than the lumen of the artery, and there's less muscle in the media of the vein than there is in the artery. One of the reasons for this is that artery is designed for high pressure flow. The flow in the veins is slower and at lower pressure. Now, when veins are ruptured, they don't shoot out like the arteries. No, they just kind of ooze. Veins also get into a lot less trouble than the arteries. Okay, now let's look at the cardiovascular scheme in its entirety. Boom! Blood is ejected out of the left ventricle. It travels through the arteries into the tissues. Once in the tissues, this capillary blood is depleted of its oxygen and a lot of other good stuff. This is why the blood turns blue. Now, these capillaries join one another to become veins, which slowly bring the blood back to the right side of the heart. Remember, the right heart pumps blood to the lungs. So out of the right ventricle, you have the pulmonary arteries, which become pulmonary capillaries, which absorb oxygen, which become pulmonary veins, which bring the blood back to the left side of the heart, and we hear that old familiar kaboom, and the system starts all over again. Heart, arteries, capillaries, veins. This is it. Your blood is flowing all of the time. It keeps your cells alive. Now that wasn't so hard, was it? Now let's turn our attention to some real life and death stuff, shall we? We mentioned earlier that a lot of cardiovascular disease stemmed from the fact that for some reason the arteries weren't allowing the blood to reach the tissues. What is going on with these arteries? Atherosclerosis. That's right, 6 syllables, a humongous word with titanic importance. Do you realize that the majority of cardiovascular deaths in this country are coming from atherosclerosis? What is atherosclerosis? To answer, let's dissect out this word. The name atherosclerosis is a hybrid of 2 words, atheroma and sclerosis. Athera is Greek for gruel, you know, like porridge or oatmeal. Atheroma means blob of gruel. Does this sound familiar? Sclerosis means hardening. So basically, atherosclerosis means gruel blob hardening. Let's take a look at atherosclerosis. These hard, lumpy formations on the inside of the artery wall are atheromas. They're named this way because the folks that first described them thought they looked like blobs of gruel. It's easy to imagine how these gruel blobs might interfere with artery function. First of all, the atheromas can increase in size and number to the extent that they obstruct the flow of blood through the artery. Secondly, these atheromatous plaques can cause coagulation of the blood. Coagulation means that the blood turns solid. When a blood clot is formed in an intact vessel, we call this a thrombus. And if for any reason the thrombus breaks loose and travels downstream, we call that an embolus. These are really bad news for arteries. So now you know that creepy gruel blob mob is actually atherosclerosis, trying to clog up our arteries and cause our tissue to undergo ischemia and infarction. Gruel blob attack! So now you know that atherosclerosis, gruel blob hardening, is a process that affects the arteries and doesn't allow the tissue to receive an adequate blood supply. Which arteries are we going to worry about the most? How about the coronary arteries? Remember, the coronary arteries supply the heart muscle with blood. I can hear what you're saying. But Dr. Smash, if we have a blockage of a coronary artery, then the heart muscle will undergo ischemia and infarction. And you know what? You're right on the money. Do you realize that you have just perfectly described a heart attack? That's right. That's what a heart attack is. It's an occlusion of a coronary artery that leads to heart muscle infarction. Now in Latin, muscle is myo. So we have a myocardial heart infarction. This is a heart attack. If you've ever known anyone who's had a heart attack, it was because they had a coronary artery occlusion from atherosclerosis and blood clot formation that caused a myocardial infarction. Heart attack. Now you know. What other blood vessels do you worry about with atherosclerosis? How about the arteries that supply the brain with blood? If these arteries get occluded by atherosclerosis, then cerebral ischemia and cerebral infarction ensue. And this is a stroke. The third leading cause of death in the United States today is a stroke. A stroke affects the brain. So atherosclerosis gives us heart attacks here and strokes here. Now, in addition to the arteries that supply the brain with blood and the arteries that supply the heart muscle with blood, atherosclerosis can affect a lot of various arteries of the body, causing a lot of problems. Now, at this point, you're probably asking yourself, what causes atherosclerosis? And how do I avoid this terrible fate? Atherosclerosis is not a natural aging process. Then what is it? Well, These gruel blobs, these atherosclerotic plaques, are composed of cholesterol and other gunk that is accumulated in the arterial wall over time. There are different theories as to why this happens, and a lot of the theories are pointing to the idea that perhaps there is intimal damage in the artery that leads to this buildup. And we've been able to isolate several factors that put an individual at risk for atherosclerotic disease. That's right, there are certain factors that put you at increased risk for heart attack, stroke, and other atherosclerotic diseases. These 4 major risk factors are easy to learn and remember. These are high, and tobacco. That is to say, high blood pressure, high cholesterol, high blood sugar, and tobacco. Let's begin with high blood pressure. High blood pressure in medical lingo is hypertension. Hyper coming from Greek for too much. Tension coming from Latin for tension. Now, hypertension is some really serious stuff. Not only does it cause gruel blob formation in the arteries, but chronic, sustained hypertension can actually cause rupture and hemorrhage of these smaller arteries. Now, when this bleeding happens in the brain, you also get a stroke. Blood pressure, among other things, depends on the amount of constriction that this arterial muscle is applying. Now, arteries will clamp down at different times for different reasons, but in some people, they appear to be clamped down a little too much most of the time. These people have hypertension. Now, when we talk about blood pressure numbers, I don't know if you've noticed, but there's always 2 of them, because the blood pressure in the arteries changes with the motions of the heart. During systole, the pressure in the arteries is at its highest. During diastole, the pressure is at its lowest. So we have a systolic pressure over a diastolic pressure. Now, to measure these, we put a blood pressure cuff around the arm.
And we listen to hear what pressure is required to completely compress and completely relax the brachial artery. This gives us our systolic over our diastolic pressure.
If you have a blood pressure that's consistently 140 over 90, this is classified as mild hypertension. If your pressure is 160 over 100, this is classified as severe hypertension. The numbers in between these two basically mean that you're somewhere in between mild and severe hypertension. Steps to take to avoid hypertension. Number 1, check your blood pressure regularly. Don't let it creep up on you. Number 2, if you're overweight, lose weight because obesity causes hypertension. And number 3, if you have problems with hypertension, be sure to watch that salt because salt causes fluid retention, causes increased blood volume, and causes increased blood pressure. Do you realize that this entire low salt, low sodium phenomenon is to cut down on your hypertension? Did you know that?
Cool!
Now for major risk factor number 2, high blood cholesterol. In medical terminology, we say, well, how do you say it? Too much, hyper, in the blood, emia, cholesterol, hypercholesterolemia. Jackpot! Cholesterol. This is cholesterol. Actually, it's just a rock that I painted yellow, but pretend that this is cholesterol. Now, your body needs cholesterol because cholesterol does a lot of good things. And your body gets cholesterol 2 different ways. First of all, you get cholesterol in your diet. Secondly, your body makes its own cholesterol. But if you've got too much cholesterol floating around in your blood, hypercholesterolemia, then you're going to run into trouble with gruel blobs because remember, the chief component of a gruel blob is cholesterol. Your body makes its own cholesterol from the fats that you eat. That's right, cholesterol is made from fat, but be careful. Cholesterol is not the same thing as fat. Do you realize that only animals make cholesterol? That's right, plants do not make cholesterol. To illustrate, observe. $10,000 calories, 100% fat, and not 1 molecule of cholesterol. Good cholesterol, bad cholesterol. Actually, cholesterol is cholesterol, but it's carried in the blood by different lipoproteins, one of which is good, the other is bad. If this cholesterol is carried by low-density lipoprotein, it can cause gruel blobs. Therefore, LDL cholesterol is bad. Whereas if this cholesterol is carried by high-density lipoprotein, HDL cholesterol, it doesn't appear to cause gruel blob. So you want as much HDL and as little LDL in your body as possible. A word on fats. Basically two types, saturated and unsaturated. Saturated fats you get from greasy foods like beef and pork and fatty meats. This stuff not only raises your body's cholesterol, but it also raises your low-density lipoprotein. Ooh, bad stuff. Whereas unsaturated fat, particularly polyunsaturated fat like this margarine, will not only lower your cholesterol levels, but it'll also lower your low-density lipoprotein. So, for recommendations on high cholesterol, first of all, check your cholesterol, and then modify your cholesterol and your fat intake. More of this, less of this. We now address the third major risk factor, high blood sugar. We're talking about chronic high blood sugar, diabetes. As if diabetes weren't bad enough, it also causes atherosclerotic disease. So if you have diabetes, it's very important that you take good care of your health, that you keep your weight down, and please avoid the other three major risk factors. Now, number 4, tobacco. That's right, tobacco causes atherosclerosis, which causes heart disease and stroke. Just for the fun of it, let's pull up the list of the top 5 leading causes of death in the United States today. Whoa, look out! This reads like a who's who list of tobacco-related illnesses. Is this a coincidence? I think not. Tobacco is bad. Very, very bad.
Do you smoke? No.
No.
We both do.
Pack a day?
No.
Sir, do you smoke?
Yes, I do.
No, I don't.
Yes, I do. She doesn't.
So there you have it. The 4 major risk factors for atherosclerosis. You know them. You've memorized them. It's now time to apply them so that you can prevent cardiovascular disease. So that's it. The entire cardiovascular system and the prevention of cardiovascular disease. Congratulations. We covered an enormous amount of material today, and you hung in there. Heart, arteries, capillaries, veins, atherosclerosis, myocardial infarction, strokes, blood pressure numbers, HDL, LDL, cholesterol, dietary fats, all that stuff.